Hey everyone, this is Mike from Rebuild Fitness and Physiotherapy. A common issue that I see with a lot of athletes and just desk warriors is that they have shoulder pain in the front. There's a lot of tissues that run in the front of the shoulders, right? We have our anterior deltoid, front deltoid. We have our bicep tendon, right? All this stuff gets kind of gunked up. And it really depends on how they injured it. So if they are sitting slumped a lot at their desk, their shoulder tends to be popping forward, right? It puts a lot of load here in the front. But it also can be from like bench press, push-ups, things like cleans where they're having to get their shoulder forward and internally rotate. It's also, it can be just from like rows or upright rows. So one of the common things is a lot of tenderness in the front of the shoulder here. And why is this happening? Well, I'm gonna get him to lie down on his back. Shoulders do tend to creep forward a bit. So what I'm gonna do is add a force, push the shoulder better in its socket. And what we need to check and make sure is that he's getting enough internal rotation, all right? And his internal rotation isn't bad. He's actually getting about 70 degrees internal rotation. So he's doing great. But some people, when you crank them, they stop here or about there. And then they'll report feeling a lot of discomfort here in the shoulder, all right? So what we wanna make sure is we have the shoulder sitting in a better place and work on this range of motion. His bicep tendon can be really tight, and we can just do a little bit of release there. So I'm just gonna pin it down and work on rotation that way. And he might feel a little bit of tenderness in that spot. Another thing that I like to address with shoulder pain is that it's not just coming from the shoulder, it's coming from his trap area. So, Evan, I'm gonna get you sit up. Shoulder slumping forward a lot. It also tends to put a lot of strain on this trap here, okay, leading into the neck. Another common treatment I like to do is, one, we fix posture, set them in a good position, shoulders are back, and then what we do is a release for the trap, where I grab the trap tissue, and we are going to hit a release that way. So he's going to gently side bend away. And then he can come back, and he gets to control his range of motion and feeling the stretch. So he's more in control of this one, but it helps release some of those tissues. Yeah, so typically after you work on the shoulder, trap area, you should have less tension in the front of the shoulder. You should have less tension in this area too, this trap. But you should just have generally better mobility and less pain. And so then when you lift, your body's in a better position to prevent further injury.